Asian rhinoplasty is different from Caucasian or traditional rhinoplasty in that the techniques are very different. In Asian rhinoplasty, we are typically making the bridge higher or larger or more prominent, as well as making the tip of the nose more prominent and more defined. Another common maneuver that we perform in Asian rhinoplasty is to make the nose more narrow or the alar base more narrow to reduce the wide nose. The techniques to do this are very different. To build up the bridge, we are using materials such as silicone implants or cartilage or bone from a patient's own body. To build up the tip of the nose, we need to use cartilage from a patient's own body to make that area more prominent and more defined. Narrowing the alar base or the bottom third of the nose is also very commonly done, and this is done by removing the skin from within the nostrils or the side of the nostrils to reduce a widened appearance. Raising the bridge of the nose is usually performed with the silicone implant. The silicone implant is carefully selected for the patient and placed in the bridge of the nose underneath what we call the periosteal layer. Augmentation of the bridge of the nose is usually done with the silicone implant. When this is done properly, the implant cannot be felt or seen. The other methods for raising the bridge of the nose include using cartilage that can be taken from either the ear or the rib. To improve the appearance of the tip of the nose, we need to narrow the tip of the nose as well as increase projection, or how much the tip sticks out from the face. To achieve this, usually in Asians, the cartilage in the tip of the nose is insufficient, so we need to take cartilage from another part of the body, usually from within the nose, from an area we call the septum, to put in the tip of the nose to achieve the desired shape and size. The most common technique to achieve the adequate tip projection and shape is to use a septal extension graft. And what this does is it elongates the tip of the nose from the inside of the nose to achieve the right shape. In addition to the septal extension graft, we place onlay grafts, which are smaller pieces of cartilage that we use to improve the shape of the tip of the nose. Recovery from Asian rhinoplasty usually takes 2 weeks off of light work. After the 2 weeks, the nose will still appear swollen, but generally most of the swelling and bruising will resolve by then.